Waking up with a dry mouth may seem like a small inconvenience. You drink some water, your mouth feels better, and you move on with your morning. But if this happens regularly, there may be a reason your body keeps giving you the same signal. And the cause is not always simply that you forgot to drink enough water. For adults over 60, persistent morning dry mouth deserves a little more attention. Sometimes it is related to something completely harmless, such as sleeping with your mouth open. But in other cases, it can be connected with medications, nasal congestion, dehydration, blood sugar problems, or changes in the way your body regulates fluids. The important point is this: dry mouth itself is usually a symptom, not a diagnosis. So rather than assuming what it means, you need to look at the pattern around it. When does it happen? How often? What medications are you taking? Are you also unusually thirsty? Are you waking up several times during the night? There is another reason I want older adults to pay attention. Saliva does much more than keep your mouth comfortable. It helps you swallow food, begins the digestive process, protects the tissues inside your mouth, helps control bacteria, and protects your teeth. When saliva production remains low for long periods, your mouth loses some of that natural protection. So if you wake up with a mouth that feels as dry as cotton, do not immediately assume you simply need another glass of water. There may be a clue hiding in your nighttime routine. One of the most common explanations is surprisingly simple. You may be breathing through your mouth while you sleep. Think about what happens when air repeatedly moves across the moist surfaces of your mouth for several hours. That airflow can increase evaporation and leave you with a dry tongue, sticky saliva, cracked lips, or that unpleasant feeling that you need water immediately after waking. This can happen when your nose is blocked because of allergies, a cold, chronic nasal congestion, or structural problems that make nasal breathing difficult. Some people also develop the habit of mouth breathing during sleep without realizing it. And here's the part many people overlook. If you snore loudly, wake up choking or gasping, have morning headaches, feel unusually tired during the day, or someone has noticed that your breathing stops during sleep, dry mouth may be occurring alongside a sleep-related breathing problem. That does not mean dry mouth proves you have sleep apnea. It does not. But the combination of symptoms is worth discussing with a healthcare professional. Sleep apnea becomes particularly important as we get older because repeated interruptions in breathing can affect sleep quality and may be associated with several cardiovascular and metabolic problems. If your mouth is dry every morning and your sleep is consistently unrefreshing, the answer may not be found in your water bottle. But there is another major factor that deserves attention, especially after the age of 60. Medications. Many older adults take several prescription or over-the-counter medications, and some of them can reduce saliva production. These can include certain antihistamines, decongestants, antidepressants, medications used for high blood pressure, some bladder medications, and other drugs with drying effects. That does not mean your medication is wrong. It does not mean you should stop taking it. In fact, stopping a prescription medication suddenly can be dangerous. Instead, look at the timing. Did your dry mouth begin after starting a new medication? Did it become noticeably worse after a dosage change? Are you taking several medications that can have similar drying effects? Those are useful questions to bring to your doctor or pharmacist. Sometimes the solution is not adding another product or supplement. It may be reviewing the medications you already take and determining whether an alternative is appropriate. And this is why I would strongly discourage one common mistake: trying to solve persistent dry mouth by simply drinking enormous amounts of water. Hydration matters, but more water is not automatically better. Your body carefully regulates its fluid and electrolyte balance through the kidneys, hormones, and nervous system. If you have certain heart, kidney, or liver conditions, your healthcare professional may actually recommend limits on fluid intake. So the goal is not to force yourself to drink excessive amounts of water. The goal is to understand why your mouth is dry and maintain appropriate hydration for your individual situation. There is another clue that should not be ignored. If your dry mouth comes with unusually strong thirst and frequent urination, particularly at night, it is worth talking with your healthcare professional about blood sugar. High blood glucose can cause the kidneys to excrete more glucose into the urine, and water follows that process. This can contribute to increased urination and thirst. Again, dry mouth alone does not mean you have diabetes. There are many possible causes, but when several symptoms appear together, they deserve a closer look. This is especially important if you have also noticed unexplained weight changes, unusual fatigue, blurry vision, or wounds that seem slow to heal. The answer is not to panic. The answer is to get appropriate testing if your clinician believes it is necessary. Sometimes a simple blood test can provide information that guessing from symptoms never could. Now, there is one area of dry mouth that people often underestimate: oral health. Saliva is part of your mouth's natural defense system. It helps wash away food particles, neutralize acids, and support the health of your teeth and gums. When saliva production remains low, the risk of tooth decay and certain oral problems can increase. You may also notice difficulty swallowing dry foods, changes in taste, a burning sensation, bad breath, or saliva that feels unusually thick and sticky. If that sounds familiar, do not simply accept it as an unavoidable part of getting older. Dry mouth can become more common with age, but persistent dry mouth is not something you have to ignore. Your dentist can look for signs of tooth decay, gum disease, irritation, and other problems. Your doctor can investigate medications and possible underlying causes. And there is another subtle connection worth understanding. When your mouth is dry, eating can become less comfortable. You may avoid foods that require more chewing or swallowing. You might choose softer foods that are easier to eat, which can sometimes change the overall quality of your diet. For an older adult trying to maintain muscle and physical independence, that matters. You need adequate protein, calories, fiber, vitamins, minerals, and fluids. If dry mouth is making meals unpleasant, addressing the problem can make healthy eating easier, but do not fall into the trap of thinking that every dry mouth remedy is equally useful. Some people constantly suck on sugary candies to stimulate saliva. That may temporarily increase saliva flow, but frequent sugar exposure can increase the risk of tooth decay. A better option for many people is sugar-free gum or sugar-free lozenges, provided they are safe for you to use and you can chew and swallow normally. Products containing xylitol are sometimes used in oral care strategies, although they are not a cure for dry mouth. If you have dental concerns, ask your dentist what makes sense for you. You can also make your environment more comfortable. If the air in your bedroom is very dry, especially during winter or when heating or air conditioning is running, a properly maintained humidifier may help some people feel less dryness. But cleanliness matters. A humidifier that is not cleaned according to the manufacturer's instructions can become a source of unwanted microorganisms. Small details like this are important because the goal is to solve the problem without creating another one. There is also something you should consider before going to bed: alcohol and tobacco. Alcohol can contribute to dehydration and may worsen the sensation of dry mouth. Tobacco can also affect oral tissues and saliva production. If you regularly have a drink in the evening and notice that your mouth is especially dry the next morning, pay attention to the pattern. You may discover that the symptom is not random at all. The same principle applies to caffeine. Coffee and tea are not automatically dehydrating in normal amounts for most people, but large amounts of caffeine can contribute to frequent urination in some individuals and may make dryness feel worse. You do not necessarily need to eliminate your morning coffee. Instead, pay attention to your overall intake and how your body responds. Now let's talk about something even more important: what your dry mouth looks like when you wake up. Is your tongue simply a little dry for a few minutes? Or is your mouth extremely dry every morning with thick saliva, difficulty swallowing, persistent bad breath, mouth soreness, or trouble speaking comfortably? Those are very different situations. A mild, occasional dry mouth after sleeping with your mouth open is usually very different from persistent xerostomia, which is the medical term used when saliva production is reduced enough to cause ongoing symptoms. And if you have persistent symptoms, your healthcare professional may want to know about your medications, medical history, hydration, sleep, oral health, and other symptoms. This is where keeping a simple record can actually help. For 1 or 2 weeks, notice when the dryness is worst. Write down whether you wake during the night. Notice whether your nose is blocked. Pay attention to snoring. Record whether you are unusually thirsty or urinating more often than usual. Also note any recent medication changes. You do not need a complicated spreadsheet. A few observations can give your doctor or dentist a much clearer picture. And please remember something important: do not diagnose yourself from a symptom you found online. Dry mouth can occur for dozens of reasons, and two people with exactly the same symptom may have completely different explanations. For example, one person may have nasal congestion, another may have medication-related dryness, another may have a dental issue, another may have a metabolic problem that needs investigation. The symptom is the starting point, not the conclusion. There is also a common misconception that dry mouth automatically means your body is severely dehydrated. Not necessarily. Your mouth can feel dry because saliva production is reduced, because you are breathing through your mouth, because of medication effects, or because of environmental conditions. True dehydration can certainly cause dry mouth, but dry mouth by itself cannot tell you exactly how hydrated you are. Look at the bigger picture. Are you also experiencing dizziness when standing, unusually dark urine, significant weakness, confusion, or a major reduction in urination? Those symptoms deserve prompt medical attention, particularly in older adults. And if you become confused, extremely weak, faint, or unable to keep fluids down, do not simply try to treat yourself at home. The body sometimes gives us quiet signals before a problem becomes obvious, but those signals need context. Now there is one more connection that deserves special attention: nighttime urination. Many adults over 60 wake up once or more during the night to use the bathroom. If you then drink a large amount of water because your mouth feels dry, you may find yourself waking again later. That can create a frustrating cycle. Dry mouth leads to drinking. Drinking leads to more nighttime urination. More nighttime urination interrupts sleep. Poor sleep can leave you tired the next day. But if you are waking several times every night to urinate and also experiencing excessive thirst, do not assume this is simply normal aging. It may be worth discussing with your healthcare professional. There are many possible causes, including fluid timing, medications, bladder conditions, sleep problems, and metabolic conditions. This is why a symptom should be investigated rather than automatically blamed on age. And if you take medications that increase urination, timing can matter. Never change the timing of a prescription medicine on your own, but ask your clinician whether the schedule could be contributing to nighttime bathroom trips. Now let's come back to the mouth itself. Your tongue should not constantly feel raw. Your mouth should not regularly crack or bleed simply because you wake up. Swallowing should not become consistently difficult because there is not enough moisture. If you notice persistent sores, white patches, unexplained bleeding, severe pain, difficulty swallowing, or a mouth problem that does not heal, contact a healthcare professional or dentist. These symptoms have many possible explanations, and they should be evaluated rather than dismissed. The good news is that many causes of dry mouth can be addressed. Sometimes the answer is improving nasal breathing. Sometimes it is reviewing medications. Sometimes it is improving oral care. Sometimes it is treating an underlying condition. Sometimes it is simply changing habits that are making the problem worse. The important thing is to identify the cause. And if you are over 60, there is another reason to take oral health seriously. Maintaining the ability to eat comfortably supports your ability to maintain nutrition, and maintaining good nutrition supports strength, mobility, and independence. Think about something as ordinary as getting up from a chair. Your legs need strength. Your nerves need to communicate properly with your muscles. Your bones and joints need support. Your brain needs to coordinate movement, and your body needs adequate nutrition to maintain all of these systems. No single symptom tells the entire story. That is why I want you to look at your health as a connected system rather than a collection of unrelated problems. Dry mouth may seem like a mouth problem, but sometimes it can point you towards something happening elsewhere in the body. That does not make it frightening. It makes it useful. Your job is not to become worried about every symptom. Your job is to become better at recognizing patterns. If your mouth is occasionally dry after a night of poor sleep, that may not be significant. But if you wake with severe dryness almost every morning for weeks, especially when it comes with excessive thirst, frequent urination, loud snoring, daytime fatigue, medication changes, swallowing difficulty, or oral discomfort, that pattern deserves attention. And here is something you can do tonight. Before going to bed, think about your medications, your evening beverages, your nasal breathing, your bedroom environment, and how much you normally drink. Do not dramatically change your medication or fluid intake. Just observe. Then tomorrow morning, notice what your mouth feels like before you drink anything. Is your tongue dry? Is your saliva thick? Are your lips cracked? Are you thirsty beyond what seems normal? Did you wake up several times? Did you sleep with your mouth open? These observations can be surprisingly valuable. And if you use dentures, dry mouth deserves even more attention. Reduced saliva can make dentures feel uncomfortable or less secure and can contribute to irritation of the tissues underneath them. Good denture hygiene and regular dental care remain important. Do not simply tolerate persistent irritation because you assume it is part of aging. There is another mistake I want you to avoid. Do not automatically purchase a large collection of supplements because you believe dry mouth means you are deficient in a particular vitamin or mineral. There are specific nutrient deficiencies that can cause a range of symptoms, but dry mouth has many possible causes. Taking a supplement without knowing whether you need it may provide no benefit and, in some cases, may create problems or interact with medications. More is not always better. This becomes especially important as we get older because many people take multiple prescriptions, over-the-counter products, and supplements at the same time. Your doctor or pharmacist can review the entire list and identify potential interactions or side effects. Bring the bottles or a current medication list to your appointment if necessary. That simple step can sometimes reveal something you never noticed. Now, if you are wondering whether you should simply drink water whenever your mouth feels dry, the answer is generally that appropriate hydration is important, but your individual needs matter. For most people, drinking according to thirst and maintaining normal hydration is reasonable. But people with certain medical conditions may have different fluid requirements, so do not follow a one-size-fits-all hydration rule from the internet. Your healthcare professional knows your medical history and can give you advice that fits your situation. And remember that fluids come from food as well as beverages. Foods such as soups, fruits, vegetables, and other water-containing foods contribute to overall fluid intake. But again, your individual medical situation matters. Now let's return to the question we started with. If you wake up with dry mouth, is your body warning you? Sometimes it may simply be telling you that your mouth has been exposed to several hours of airflow. Sometimes it may be reminding you to review your medications or hydration. Sometimes it may be a clue that your sleep, blood sugar, nasal breathing, or oral health deserves a closer look. The key word is may. Dry mouth does not diagnose a disease, but persistent symptoms should not automatically be dismissed. Your body communicates through patterns, and learning to notice those patterns can help you have more productive conversations with your healthcare team. If you are over 60 and this happens to you regularly, take a moment this week to look at the bigger picture. How is your sleep? How often are you waking at night? Are you unusually thirsty? Are you urinating much more than before? Do you snore? Are you taking medications that can cause dryness? Is your mouth uncomfortable during the day? Are you having trouble eating or swallowing? Those questions can help separate an occasional nuisance from a persistent problem that deserves evaluation. And if you have been experiencing dry mouth for several weeks, especially if it is interfering with eating, speaking, sleeping, or oral health, make an appointment with your doctor or dentist. You do not need to be frightened. You simply need to be informed. At this stage of life, protecting your independence often comes down to paying attention to small changes before they become bigger obstacles. A dry mouth may not be serious, but sometimes it is a clue. And the smartest response is not panic, self-diagnosis, or unnecessary supplements. It is observation, appropriate testing when needed, good oral care, sensible hydration, and a conversation with a qualified healthcare professional who knows your medical history. Your health is not defined by one symptom. It is the pattern of symptoms, habits, medications, sleep, nutrition, and overall function that gives the clearest picture. So tonight, before you go to bed, ask yourself one simple question. Has my dry mouth become a pattern? If the answer is yes, do not ignore it, but do not fear it either. And if you have been waking up with dry mouth, tell me in the comments how long this has been happening and whether you also experience snoring, nighttime thirst, or frequent bathroom trips. Your experience may help someone else recognize a pattern they have been overlooking. Most importantly, keep learning, keep asking questions, and keep having these conversations with your healthcare professionals. Small observations can sometimes lead to important answers, and staying informed is one of the best ways to protect your health and independence as you grow older.